This is study results from the huge, expensive, prospective Women's Health Initiative that was started 18 years ago. And this is really impressive results of thousands of women. The results are very reassuring. So for women who've either taken hormones or not taking hormones, overall, there's no difference in death rates. From cancer, from heart disease, they looked at general mortality and cause-specific mortality. 15 years ago, we got the first report of the estrogen-progestin arm, which sent shock waves around the world. Women were petrified, they stopped using hormone therapy. And it's really a shame because we lost almost a whole generation of women, and many women with hysterectomy stopped their estrogen. And the estrogen-only arm results weren't even out. And women under age 60 with hysterectomies who take estrogen actually have lower death rates and a specifically lower risk of dying from breast cancer significantly. So we've learned a lot in these last 18 years, but unfortunately the message is still out there amongst many physicians and many women that hormones cause cancer, hormones increase death rates. And we have excellent data showing that's not the case. And this was a study of older women, primarily without significant menopausal symptoms. So when you look at other studies of younger women, women starting closer to menopause who had symptoms, you see even more significant benefits, including reductions in death rate. The take-home message is that women should be ecstatic that they have options. They don't necessarily have to take hormones if they're not hormonally deficient, but if they are, they can take them safely and effectively. And we do have new designer hormones because we did see differential effects between estrogen alone and estrogen plus a synthetic MPA hormone, which showed a higher rate of breast cancer diagnosis with use, but overall no significant increased rates of death. So we continue to refine and have more options, and it's very important for women to get individualized evaluation and therapy. I think that this research is a continuing commitment from the WHI to hopefully help correct their misconceptions. When they published back in 2002 this global index, it wasn't a validated index. They only plucked certain disease states, and the numbers were very scientific, but they were unscientifically interpreted, and it really caused vast changes around the entire world. And unfortunately, hormone therapy has been held to a much higher standard of therapy than diabetic medicines, cholesterol-lowering medicines. A lot of women don't realize certain cholesterol-lowering medicines have higher rates of breast cancer diagnosis, much more than even estrogen plus MPA. So I do think this is hopefully a game changer for the group of physicians and patients that really weren't aware of the previous data. I mean, I've been saying and writing all along that people didn't need to change their practice patterns. And so it's almost like the pendulum is swinging back. And I think that if there's any lesson, the lesson is one study does not answer everything. One size does not fit all. And there really should not be hysteria in looking at any scientific study. It's just one more piece of the puzzle. But I think in terms of the overall puzzle of menopausal hormone therapy, there's lots of options and women should feel empowered. Well, for women still nervous about hormone therapy, I think they need to get accurate information, see a menopause specialist, visit our website, speakingofwomenshealth.com. We have excellent free treatment guidebooks and the latest research and information that we put on our website to empower women. And I think that this has been a very instructive lesson in terms of how science has been translated into the media. I think this is one of the first big studies where we saw that. And women are big consumers of health information online, and I think that's good to be empowered, but you've got to have the right information. I'd just like to make the point that if you're young and you're symptomatic, and particularly if you've had a hysterectomy, you should strongly consider estrogen therapy. If you have symptoms and have been on hormone therapy, you potentially have some mortality benefit as well as lots of disease-specific things. If you're a woman who's in menopause without any symptoms, you don't have to feel badly that you're not taking hormone therapy. I think that's another important message, but that all women should be assessed at menopause for symptoms, bone health, sexual health, and their overall medical condition, and then be individualized. And we have both hormonal and non-hormonal options for women.